of you on behalf of Himalayas, on the behalf of this particular serene location established by His Holiness Swami Ram. I have been blessed by his presence and I have been visiting him very frequently when he was in physical sheath in this earth. Swami Ram, as the Gita says about the people like him, these people, they rarely come on this earth, but when they come, they leave so many things for us. They leave footprints of their deeds. Yadyada charati shrestha tat devottara jana. Lord Krishna says in Gita, the 3rd chapter, Yadyada charati shrestha tat devottara jana sa yat pramanam kurte lokah tad anuvartate. Whatever he does, the whole world follows him. And they live a life of wise personality. I really worship him today, and I see the progress of the whole university, the Himalayan University, under the very able guidance of these two dignitaries, Vijendra Singh Chauhan and the Dr. Vijay Dhasmana. These two, under their leadership, have blossomed this particular university in such a concept has been developed, in which today we are doing this pathology conference. Present on the dais, Dr. Vijay Dhasmana, Dr. Vijendra Chauhan, Dr. Ashraf Khan, Dr. Gaur, Dr. Pathak, and all of you, all the dignitaries from the whole country, from abroad, ladies and gentlemen, my dear students, second professional students who are seated in the back. I can see the enthusiasm in you with the conference opening today, and all the other staff members of the Himalayan Institute Hospital University. My dear friends, I have been a physician since last about, you can say, 30 years. I passed out my degree in medicine as an MD in medicine in 1975 from MGM Medical College Indore. At that time, I had a ambition to go to US and do my practice there. But when I went to my guru, Pandit Sriram Sharma Acharya, that I want to go abroad and I have passed my ECFMG examination, I got a job in 10 places. I want you to select one of it. Then ultimately he said, why do you want to go? I said, I want to serve the country. Well, you go abroad and you serve the country here, how will you do it? Then I told him that I'll earn a lot of money and I'll come back and I'll start a hospital. And he said, why don't you stay here and help me out? Where is the appointment letter? He took the appointment letter and tore it. And then he said, work with me. Prepare a theme of the scientific spirituality, how we can combine these two disciplines. You're already MD in medicine. Leave all your ambitions and leave everything to me. I'll groom you the way I want you to do. And at the age of 24 and a half years, I submitted myself to him. Today, when I see back to my life, whatever has happened in so many days, I find that I had done taken wise decision. I studied all the systems which you have been teaching in this institution. The pathology was the subject which definitely fascinated me. It was the one in which I did my dissertation of MD when I did my histopathological studies of the neurons and the diabetes. That was the study which I conducted. So that definitely my interest in pathology was immense. But definitely for a person going for a clinical subject, he wants to have the subject which is of challenge. I worked in cardiology for a long time, and I really found that without pathology you cannot go to any level of discipline. Means any diagnosis cannot be done without pathology. Today, pathology has established itself all over the world. We are passing through the great moments of change all over the world. Globalization has changed the scenario. You can see the people from abroad coming to India and giving their wisdom to us, to all our young students. I have got my university with more than about 2,000 students, and there also I get a lot of visiting faculties from abroad, and they come and deliver their knowledge. In the field of pathology, especially the pathology with surgical pathology, which is very, very important, which we are going to discuss today. I am not an expert in that. I am an expert in spirituality right now with the synthesis of the spirituality and science. But what I like to throw light on will be the practice of surgical pathology allows for definitive diagnosis of disease. In any case where the tissue is surgically removed from a patient, this is usually performed by combination of gross and histological examination of the tissue, and may involve evaluation of the molecular properties of the tissue by immunohistochemistry or other laboratory tests. When I see back during my days the pathology and during these days pathology, the pathology has immensely changed. Means we have gone to the micro level, mini micro level, and now we can diagnose the patient very early, at a very early stage. And once he has developed a small nodule somewhere in the throat and he says there is a hoarseness of the voice, ultimately when he goes to the doctor, he does a endoscopic examination and removes the tissue and sends it for biopsy. Immediately the diagnosis is established and this is removed before it is metastatic. Now this particular thing has changed the scenario of the treatment. A lot of people are surviving now. The histopathology, the surgical pathology, you are operating a patient, you send a sample, you get the diagnosis, and ultimately you decide what to do. This is something that has helped the surgeons also. And humanity is getting so much of advantage by the modern pathology that I truly realize that this particular discipline has revolutionized the medicine today. If I don't know how many of you have read the book The Emperor of All Melodies. If you have read that book, you know very well that how the malignancies the Dr. Siddharth Chatterjee has elaborated very rightly in that book, that how much important is this particular system to know about the various disorders, and out of them the worst disorder today is I think malignancy. And the oncologist, the histopathologist, they have a very good relationship together, because the oncologist will not be able to do anything without the help of the histopathologist. And this particular thing gives a upper edge to the field of pathology, and anybody going to the field of pathology, he is the person who is giving the opinion exactly at the moment when the treatment is being given. How the treatment should be monitored, that thing is being also regulated. So what I personally feel is that this particular continuing medical education program, this CME, will definitely highlight many things to our young students, to our all teachers, to our all delegates. Many of you must have participated in a lot of CMEs, but this particular CME at the foothills of the Himalayas, on the bank of Ganges, in the place of the worship of Swami Ram, Himalayas, Garhwal Himalayas, a very, very pleasant location, definitely will give you a lot of insight and a lot of knowledge about what is to be done in the future. This particular university is not very big, but definitely it is just like a nursery. And from here, a lot of new possibilities will emerge in near future. I extend my full cooperation to Dr. Vijay Dasmana. For my university and his university, we can work together in many respects. I am working on the various systems of the indigenous systems which enhance the immunomodulator system, like yoga, like modern psychological practices, various things which are now being used, like panchkarmas, and they are being misused by the various globalized facilities like spas. But those panchkarmas which are really very, very influential and very, very effective are being practiced here also in the Ayurvedic faculty in Himalayan Institute. I feel that there should be pathological studies to be done, that few cases are being treated by modern medicine, few patients are being treated by the alternative system of medicine. Complementary alternative system of medicine, CIM, has been established all over the world now. How the changes can be brought in the pathology pathology of the state. I'll just narrate one example. It is the example is of during my days when I was studying. Patrick Mary was a lady in England, and she was diagnosed as a carcinoma breast, and it was a pathological diagnosis, and she was to be given this treatment, and the doctors, they asked that will you like to have the treatment? This is the treatment devised by the treating physicians. In London, she was being operated. She belonged to a very small village near Ipswich, and she said, how many days I had left? I have been left. Means how many days I am going to survive? They said less than 6 months. Less than 6 months, even if the treatment is given. I am talking of 70s, 72, 73. That time we didn't have many remarkable medicines, remarkable cancer hospitals, remarkable oncologists like today. And she was said that you can opt for surgery, you can opt for anything, but you will survive less than 6 months. Then she said, let me do my whole life, 6 months life, according to my wish. But just tell me one thing, why I was diagnosed so late, that the whole system became deranged, and then I was informed. Then they told that you live in a small place. By the time you come to our place, there were only less number of machines, that time CT scan machine. And because of that, the lack of availability of the equipment there, you came here late. Now, what she did, in that 6 months period, she started making appeals on radio, on television, and various posters, various things she started publishing. And she made an office, and she started publishing that kindly help those who may die like me. I'm going to die within 6 months, but rest others who may not die in future, kindly help those by preparing a clinic in your nearby areas, and that clinic should be diagnostic clinic. There should be a surgical pathologist there, there should be a CT scan machine there, and all should mammography there, everything should be done there, and there should be a decentralized approach. You won't believe, 6 months passed, 1 year passed, 2 years passed, and she survived. After the survival, one day her secretary advised her that kindly you also go for the test. You got so many institutions, about more than 300 institutions you have set up all over the England and nearby European countries. Why don't you go for surgery? Why don't you go for checkup, a routine checkup? Why should I go for routine checkup? Do you know that you will diagnose malignancy of the cancer of the breast? She said, how do you say like that? Well, yes, that is the reason that you are here in this field. Then she said, do we have the papers? The old papers were taken, and then she went for the diagnosis. The diagnosis was done, the biopsy tissue was taken just for this, because nothing was found on CT scan. Everything was normal. And after everything was done normal, then they said, who said that there was a cancer? Who said there was a malignancy? Mary said, you said that there was a cancer. And how it has been cured? Because of the sense of service. Because of the sense of the pattern which she adopted in her life. Because of the whole morning to evening discipline of service to others. You see, service to others creates such a histopathological changes in the body, that all the physiological changes in the body, that every system starts working in our way. And this is how she survived. She survived till 1980, and then she died with a very big institution. This is a story I told you to tell you that how a malignancy can be transformed into a non-malignancy. You might be your scientist, and you might be saying that this story says that she was not diagnosed properly. You might say that she was not seen regularly, monitored regularly. I'm saying one thing, that I have seen lot of patients who responded to the various therapeutic trial, but they responded very well to the autosuggestions, heterosuggestions, yogic disciplines, and this field should be open to everyone, because we are passing through the 21st century, second decade, and you see the waves of change everywhere. You can see the waves of change in Egypt. You can see the waves of change in India. against corruption. All over the world there are changes happening. The medicine is changing very fast. The surgery is changing very fast. All the therapies are changing very fast. These CMEs, they carry very important value. I hope that all of you will come to some important decisions, important conclusions during this particular conference. I hope that the discussions will continue, go on, and this CME will not stop here. The next CME will decide about the follow-up of this. I welcome Dr. Ashraf Khan, who has been a pioneer in this field from Boston, UMass, and I believe that the exchange of the doctors, exchange of the experts of the various fields here will definitely bring more and more a value-based therapy system in our country, because we need it very badly. We need it because of the number of patients, too many number of patients, very fast growing population of this country. There are small pathologists at various corners, and they are doing diagnosis. There is a need for the awakening of all the pathologists all over. Make a right diagnosis, make a correct diagnosis, because your diagnosis decides the treatment. The patient might be given a very strong treatment without any demarcation. You might be knowing that the totally resistant tuberculosis has come. MDR was there, multiple drug resistant. Now it is totally resistant tuberculosis, and this strain has been diagnosed in India. Now this strain of tuberculosis needs to be diagnosed rightly, because if it is not diagnosed rightly, then the medicine, whosoever prescribes medicine, he will prescribe wrongly. So I believe that this particular CME will definitely come out with a lot of conclusion, especially on surgical pathology and the histology, various disciplines of pathology. Being a man of medicine, I could not cover anything about pathology, but whatever I can conclude is that this particular conference will definitely bring lot of laurels to many students, and it will be enlightening those people who will definitely be able to help the mankind at large. Doctor's profession is just like a Brahman's profession. Brahman means चिकित्सक. चिकित्सक के दो काम होते हैं, ब्राह्मण के दो काम होते हैं, चिकित्सा और शिक्षा. सौभाग्य की बात है कि चिकित्सा और शिक्षा दोनों आप लोग दे रहे हैं यहाँ पे. It is just a sheer coincidence that the medicine and the education being rendered by you. And Brahman का मतलब, मेरा मतलब caste से नहीं है. Today we are living in a very dangerous world. The moment you utter a single word, Brahman or Kshatriya or then Jati, then the politics starts coming up. I am saying Brahman means the one who lives for others. ब्राह्मण भूसुर कहते, धरती पर रहने वाले देवता को ब्राह्मण कहते थे, जो दूसरों के लिए जीता, लोक सेवी, the service to others. That particular concept of Brahman has to be maintained by all the physicians, all the pathologists, all the surgeons, and all the people who are present here, and those who are going to become doctors in future, they should also understand. I invite all of you to visit my institution also if you get time. It's only 28 kilometers from here, half an hour drive, and Dr. Dasmana ji and Dr. Chauhan ji might help you to come if you get time. And if you are busy in discussions, then Gyan Yagya should not be disturbed. Yeah, I won't like you to get disturbed in here, but if you get time, this time or any time in the future, it is just closer to you, because we are on the outskirts of the Haridwar. It is on the highway, national highway, and we are just in the border of the Dehradun and Haridwar district. So Shantikunj welcomes you. All of you are welcome. Thank you very much.